little bit of traction. How's that feel? You comfortable?
Yep.
Cozy? And then, of course, we're going to do the neck thingy. Momi, are we rocking?
Yeah, where are you?
I'm going to be at his right leg for a couple minutes. Okay. So the assumption is we did the upper body. We're done. So I would have done his neck, come down, contact, contact. Now he knows I'm at his legs, no surprises. And we're checking rotation. If anything's sore, let me know, Martin. If it's not sore, you can just enjoy. So he's wearing shorts. I can pull him up and get access. So in the video, it does not show, but you hear the question, did we not do myofascial on the quads because she's wearing pants? Because the woman in the video is wearing pants. And the answer was yes. So he has shorts, so we're going to do some myofascial. Could you help me, Aaron? I want to get the sequence to match the video for them.
Okay, so I play the video or something?
Yeah, if you can kind of like blitz through it. I think I have this part. So I'm doing just one line. So palm pressure, knee out. So going down, going up at the same time. Then I come back. Come back. Now, I'm going to go down to just above the ankle, and I'm going to just do thumbs. And they're just traveling thumbs. Just like that, yep. And when you get to about 6-8 inches above the lateral malleolus right there, that's where the fibula is kind of curved and it's close to the skin, and there's a nervy spot right in there. You ever get nervy stuff in there, Martin? Rarely, okay. So then we're just following. And this is going to take us to where our focus is going to be, is his hips. And then we get on big tissue. You can go back to palms. You can stick with thumbs. And I'm going to scoop under his hip. And I'm looking for his SI joint. So we know his spine runs down the middle, unless he's from some other planet or galaxy. His spine runs through the middle. So we don't have to reach all the way to midline. We're just going to reach under, close to the spine, and the easiest way to do that is from up high, and then I'm right on the top of his hip, coming off to the side. Now the pads of my fingers are on his SI joint, and you can see the SI joint on the skeleton there. So I have my finger pads on the SI joint, and I can push him up like that. And then I'm going to hook my forearm below the hip bone, below ASIS. And so we can follow his breath if we want, but since it's just teaching, I'm going to just do the movement. So normally when he inhales, I would push up because that's pushing his hip into flexion. And then when he exhales, I'm going to push down, gets him into extension. And I'm not pushing straight down. I'm pushing down and tractioning the hip down. He inhales, I push up, come down. How's the pressure, Martin? And you feel that little traction when I pull like this, yeah?
A little bit, yeah.
And when you're tractioning, are you keeping some of the pressure? Because that's the pin, right?
Well, we're not really stretching. I'm keeping that pressure good and hard. I'm keeping contact. So when he inhales and I push up, I ease up. Exhale, I come down. Inhale, up, exhale, down. You watched this part already? Mm-hmm. Okay, so it makes sense. So I come down here and I'm going to just move so that I get my forearm directly below ASIS.
Am I like right around the spot that you went
Yeah, you're right there.
Okay.
And so I'm going to bring his leg out, pin it, stretch it. Bring his leg out. And it's just gravity bringing the leg out. You feel that little stretch, Martin? Mm-hmm. Good.
Is this yours, by the way?
Yeah.
Okay.
So this is TFL, tensor fasciae lata. It is the muscle on the front of the body that attaches to the IT band. IT band's a sheet tendon, crosses over the knee. Runners get IT band syndrome. And you can roll and pound and massage the IT band all you want, and it ain't gonna change until you work TFL and gluteus medius, because those are the muscular connections to that tendon. So a tendon is non-contractile and non-elastic. It doesn't stretch unless you're in a lot of trouble. A stretched tendon is a really bad thing. So you want to address the muscles. They contract, they stretch. That's where you go. So from here, can you pause that?
Oh, sure.
Did it go straight into the? Oh, no. Yeah, go back.
Okay.
Back, back, back. Perfect. Right there, and then pause. You can go forward 10 seconds. And then pause. So this is where she wasn't wearing shorts, he's wearing shorts. So we just bring his shorts up, expose. Notice how much lotion I have.
None.
If he was really, really hairy, I might do a little bit. If his skin was really, really dry and I wasn't getting that traction, that's not really hairy. Yeah. So this is the speed at which this stroke would be done. And I straightish arm, sink into the quad. He's feeling that. And then we're waiting for the quad to start to move under.
You're not sliding, you're just letting it.
I'm just leaning into it. And the muscle is moving. You feel it? So that's a muscle fasciculation. The muscle's like doing this weird alien dance. And it's like.
Sometimes more than others.
Yes.
There it goes.
Yep. So this is a conversation between the pressure on my hand, the traction on the tissue, and his subconscious. We can chat all we want, but I don't care about the conscious conversation. I care about what's going on down here, which is his subconscious is telling his quad, you gotta let go. And the reason it gotta let go is because a muscle can't sustain a contraction under pressure. I'm supplying the pressure.
And you're leaning against the table while you do that?
I'm leaning on everything, yeah. But most of my lean, and you're going to see when I do the next stroke, because I'm going to do another stroke. And depending on what you're working on, if you're doing a full session, which is what you guys are learning to do, 2 or 3 is plenty, because you see how long this takes?
Yeah.
This is not exciting. This is like, So we come back. I'm going to switch. You see how I switched my feet?
Yeah.
Now I'm in the table, I'm in his body, and I'm going to sink a little deeper. You good on that pressure, Martin?
Yep.
He's like, yeah, I'll give you 1 hour to knock it off.
Yeah.
So you could conceivably find a friend that's got crazy tight quads and just do this 10 strokes. 10 times. That'll take you a half hour.
I'm going to try that.
And then walk away. And they're going to be like, you need to make my other side good too. Because the change is so profound. They're going to be just like, what? All she did was push on my quad. And so this is a really good example of myofascial release. It's not glamorous, it's not exciting, but it works so good. And what better muscle than a quad? It's a really big,
So
broad.
you can't do that like over the pants.
It's really hard, and when you slip, you're going to be like, I'm not doing that again. Because you will slip. Yeah, my joke is denim is the enemy.
Yeah.
And then stretchy pants are pretty good, but you can do like palmar compressions, moving down
Yeah.
with some tissue drag and grip, but it's nothing like this skin contact. Because really what's happening is my skin is gripping his skin, and we're taking that tissue to it. You see how it's stretching? When this stretch happens, the deeper tissue is getting stretched. And so we're adding pressure and stretch, and that's actually taking all the connective tissue right down to the bone, the periosteum. And that's why it's so much information for the brain. The brain is like, that's not something that happens every day. We're going to have to change what we're telling the muscle to do. Now, when I do this quad, I'm going to have you guys squeeze it like this so you can feel it. It's already softer, and so you can't really tell. So then I put, what's that?
You could already tell the difference. You're like, we're going to have you squeeze this
Yeah.
one, and then you did that one.
Well, you can squeeze this one and then squeeze that one.
Just by looking, yeah.
Oh yeah, that's a big difference.
And that was 2 strokes.
Yeah.
So imagine what's going to happen with your friend when you do 10
Oh,
strokes.
I want to try that.
And, and just set them up good. Like set them up with this, set them up with this, get them decompressed, and then go to work. Male or female?
Female.
Okay, so if she's comfortable wearing a bikini bottom or she has something loose enough to get to ASIS, you're going to drop the heel of your hand just below ASIS. This is his to start. You want to start as high on the quad as you can get, and we go. So I'm just working on whatever his garments give me access for, but if like he wasn't wearing a compression and I could just go up, I would have started at that bone. That's just information.
Bikini top next time, please, Martin?
Remember that thong Jackie got you? That's what.
It'll
Or
be
that
pink.
one.
So now this is where we start really tractioning his body. And I just went from this stroke, guided myself down, confident grip, lift, drop. I'm not holding his leg. There's almost no effort. If we multiplied this by 100, I still wouldn't be stressing. And so now all I'm doing is just soft, and I got him pinned, and I could actually take him with me. So you see how I can traction just the hip, or I can traction and you'll see all of him move. And so you can go 2, 3 breaths, 1 breath, come out, little compression, inhale big please, exhale. If you're gonna time the breath, traction is on the exhale. If you're gonna do a multiple breath traction, you start tractioning as they exhale and you can hold it through several cycles. When you're gonna come out of traction, watch for their breath and you go on the inhale to come out. Hands on either side of the knee, and now I control where his hip goes. Now his leg is still resting on my hip. That's pretty solid. Like you don't feel like you're gonna slip or go anywhere, right? And so I'm moving him with my hips. It's really hard to go against hips because they're the biggest, strongest body parts. So even if he like had a spasm and he kicked, no big deal. I'm not going anywhere. And so here, I'm just kind of paying attention to where his joint goes and how easy it goes. Now my fingers are in the popliteal fossa, directly behind the knee. And so because he mentioned hamstrings cross the knee joint. So if we get back here and we go a little traction, a little soft, pin, stretch, release, pin, stretch. Can you see what's happening in there, Ashley? Mm-hmm. So I'm just doing this, pin, bend, stretch. And ask him how that feels.
How does that feel?
That's what I would need.
It's like people, and they don't even have to be athletes. It's just people are like, oh my God, that back of the knee with the hip traction, so good. So then from here, this is a transition you really want to pay attention to because I bend the joint by leaning my hips forward, and then I transition. I'm back on the floor, and you don't want to hold a leg with your biceps because it's really hard. So you just come under it, and now you don't have to work. Even if he increased this by 10 or 20, it wouldn't be too hard because I'm not holding it with a long lever out here. So here, he's secure, it's comfortable, and then I have both my hands to come in on the knee. Now we're protecting the knee, and we're gonna check rotation. So I'm gonna plunge straight down into the hip, rotate. There's a little bit of resistance, great. Come out, go this way. He has almost no internal rotation. Who's good at geometry, math? Okay, if this is 0, how many degrees is this?
How dare you?
Good. Very good. High five on that. Nice. Now, is that how he's supposed to be? Let's find out. So now if the person's not too big, you just come in, decompress, and then how much does he have? Oh, no, that's how he's supposed to be. And so most people, 20, 30 to 45 degrees. External rotation, femur rotating that way, should be 45 to 90. He's actually tight in both directions, which would indicate what muscle groups are really, really tight. I'll just do this while you guys think. And then you can glute stretch, let me know.
Yep.
Good. See how easy that was?
So you did that, like, that's essentially the reverse of what you did this way,
This?
by doing that? Like when you come and you
Down.
Yep, I'm going into the easy direction first. And I'm going till there's resistance. And then I'm pushing his knee towards his opposite shoulder. Feel that glute? Does it feel good? Big stretch. So Martin's been, what's your focus been fitness-wise?
Running now.
Running. Okay. So great clue. Running is a very small window in range of motion. So runners are stiff. If Martin had been focused on a different discipline that had full range of motion, I would be able to get his knee to his chest this direction. But because he's not using that as much, because he's running so much, it's not there. So now we did this a couple times, the easy way. Got that little glute stretch, boom, glute stretch. Come out, traction the hip. His brain's already like, hey, you know what? More space is better. So it's already remodeled the hip some. See, I didn't pick it up that time. So now we come in and we're going internal rotation. Femur rotating in, and we're using the head of the femur as a plunger in the socket. This is joint capsule work. And you don't want them to anticipate when you're going to do the big stretch. That's the big stretch. And then you come out. And then you do the other way. And if he was counting, he would have been like, okay, that was 6, it's coming, so I did it on 5. Because you don't want them to help you. And then here he's going to be like, oh, he did 5, okay, and so I'm going to do it on 3. And so then, okay, and then we come back, traction. Hey, Aaron, can you advance the video?
Yes.
Just do 15 or whatever. Go, 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 go.
Here, you don't have to keep saying that, I know.
Okay.
Tell me when to stop. Yeah, it's not going.
The inner web is slopey. Okay, we did that.
I know, I was going to try and catch up to.
Oh, okay, perfect. Pause. So from here, we're just taking the leg back, putting it on the pillow, have a seat next to the pillow, and we're going to clamp the quad. Now, you've seen people with really, really big quads, and you've seen people with little quads. Little quads, you can do this. Really big quads, you're going to do something like this. Whatever you end up having to do, you choose based on physics. Are you big enough, strong enough to do this without hurting yourself? If the answer is no, skip it. Don't do it. But he is good size. I can do this. So all I'm doing is taking all of this muscle and I'm trying to rotate it on the bone. So rotate, rotate, rotate. And as you get close to the groin, you change your grip to stay away from the groin. Feels good when the meat goes around the bone, huh?
Can you show me the other version? Just
Well, his quad ain't big enough. Sorry. Yeah, it has to be like you hug it. And you can, you can do this. You can do this. You can do this. I don't work on a ton of huge individuals So I very rarely have to do it because, you know, a quad can be 3 times this size and I still can get my hands on there enough to move that tissue.
Okay.
So I'm talking like 350 plus.
Yeah, I do have one client that is bigger.
Well, you're going to choose
Yeah.
whether it's worth it or not.
Okay.
If you feel like you got to take a 2-hour nap after, you did too much.
Yeah.
Okay, and then from there we come out. Double check. I'm just trying really hard to keep it in sequence for you guys. And then we're going to go right up into world's biggest thumb, which is my knee on his hamstring. I'm not holding any weight. This is just guidance. So here, you see how if I just bring my hips forward, I increase the pressure. If you tell me if it's too much, okay, because I'm going to show them leverage. If I want more, I just bring my hips forward as I pull my hands back. You lock them in, more pressure, right? And so now we want to introduce, this is the pin, this is the stretch. Hair okay?
Oh yeah.
Okay.
This is so cool.
This one's amazing.
This is the pin, this is the stretch. I'm working really hard. But he's feeling it because I'm just like over here hanging out. Now, if you guys come around this way, you're going to see what's really happening. How many muscles make up the hamstrings? First guess is usually your right guess. 3. So you're going to have a couple different points of contact. Now, I'm using my inside knee, and if I slip, it's likely I'm going to slip this way. If I use my outside knee and I slip,
Oh, that's bad.
that's bad no matter who's on your table.
Yeah.
Yeah? So these are the things you think about when you're working, because we're going to come down into some personal space, and we want ischial tuberosity, where the hamstring inserts. So now I know my knee's getting close, so I'm going to help it along, help it along, help it along. And now I'm coming right off of it. Knee goes into the table. And I didn't risk any of it. Look. Now we're getting some rotational stretch. And I just pin it, getting all in there. If anything's sore, let me know, Martin. Das ist gut. Good. So I know the ischial tuberosity is right there. He had tight hamstrings, so we might give it a little extra work through that ischial tuberosity. And it's nice because he has shorts that are gliding on his compression shorts, so my knee's not getting raw. Now, if this was skin, I would put a tiny bit of lotion on my knee, and that's it.
I was going to ask if you can.
You want to pull your compression shorts up for me?
Up this way.
Down, yeah, up towards your hip. So I'm going to demonstrate the volume of lotion that goes on my knee for their hamstring. That's it. So here, I simply put it on my knee, and then we'll turn that myofascial stroke into a little more of a glide. And someone with really tight hamstrings, you want it to be more myofascial, but the glide feels nice too. Which do you prefer?
The first one.
Yeah. But sometimes you'll have people that are like, oh, the hair. And 9 out of 10 times it's the fascia that they're feeling, but they think it's the hair.
Yeah, because it's like that burning.
Yes. Okay, and then we come out of there, do a little traction, replace his fancy pants, traction, and then you're ready to come across. Look, I'm still not holding a ton of weight. I come around. Yep, perfect. Come around, heel of the foot in the palm of my hand. ASIS in the palm of my hand, and we come across the body. Now his leg wanted to bend, so I'm more on the side. I'm holding his foot good now. Across the body. I'm going to show you a couple of variations of this that aren't in the video.
Same,
Okay?
of course.
Because we got options. So if he was really stuck and compressed, where do you feel this stretch, Martin? Okay, cool. If he was really stuck and compressed, I might have him here, and I would continue the traction as I come sideways. And then I can do both hips at the same time. And then if he wasn't overly compressed, just tight, I'm going to block. I call this the canoe paddler, and bring him over. And now you feel that in your low back and, yeah, okay. And then if we want to make it active, you're going to take this hand. As you exhale, you're going to reach up overhead and ballerina style. Now we get from the knee to the armpit. Big breath in and reach and blow. And so, like, how hard is that? Okay, that's good. We got that. Then I come back. I'm going to stretch here a couple times. And it's just because he's tighter than a normal person you're going to see. Otherwise, you would just go right back into the compression. Okay, can you advance it? Good, good. Okay, and then now we're going to come and focus on the, what is this muscle again? Tibialis anterior. He's a tib raise guy. He can do tib raises. And we're doing pin and stretch. And you hear his toes popping because we're stretching stuff. So if your thumb doesn't want to do it, heel of your hand, heel of your hand. If your heel of your hand doesn't want to do it, knuckles, forearm, elbow, whatever works for you, you're doing pin and stretch down the outside of the front of their shin. Then you come down to the foot. Whoa, what? Do footwork. I'm going to check how his foot and ankle move. See, there's a little decompression there. You felt that? Then I'm going to come in. So I have his heel, boom, forearm, not above, not on, below the knee. And then we get the stretch. You see that? So come on around. Momi, you might want to go in this angle for this stretch. Because I'm going to be like this.
Oh, wow.
You feel the calf? So here we go. Stretch. When the leg is straight and you stretch, it's the calf. Gastrocnemius, that's stretching. We want to go immediately from there into the soleus, which is the deeper one. Your soleus gets stretched and works when your knee is bent. So I'm going to take some of the slack out with his toes and soleus. You feel that?
A little bit.
Tell me when you feel it right behind your shin. Okay. Right behind your shin. So I'm going down and pulling up at the same time to increase my leverage. And I change the angle of the foot for the angle of the stretch. And there. So make your life easy, always leverage. So if you're okay, you can block their foot like this. Are you relaxed? Will your knee fall out further? See how I'm blocking him? So now I can just come into the calves. And this, you got to be careful. It's the pads of your hands. Watch their face, because this is where some people will squirm. And I'm just sinking to where his resistance is. And because his knee's bent, I'm accessing both gastroc and soleus. Now, if I wanted to go deeper, I just lean back into it. And I know he's going to feel it. So I'm going to say, as soon as it gets intense, pull your toes up into my hip. There. As soon as he pulls his toes up, reciprocal inhibition, it's a little less intense. You want to do that a couple more?
Sure.
Or is that too much?
I think we need it.
Okay, go. Pull. Pull, 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 pull. Okay. And pull, 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 pull. Perfect. And relax. And then you just make nice afterwards. Because, you know, what's happening? Oh, yeah, that's mine. That's my jury.
So that was not in here.
No.
Okay.
No.
Can we talk about the fact that it wasn't in here?
Oh, yeah, she's wearing pants.
Oh, okay.
Yeah, so if the more someone's clothed, the less lotion you'll use, and you'll be more compression.
We do want people to be less clothed.
Yeah. The best case scenario, male, board shorts, workout shorts, female, workout shorts, stretchy shorts, sports top, modesty wrap.
If not, if you don't have sports top.
Best case scenario. If someone shows up, I have a client, super athlete, she wants a t-shirt all the time. So all of her chest work is through the t-shirt, just no problem, no problem. Come here, am I gonna get pec minor? Of course I'm gonna get pec minor, it's still there, it's right there. So it's just no skin glide. So we work on the people where they are, we meet them where they are. But we're talking ideal situation, workout pants, lots of skin, female workout short, sports top, modesty top, lots of skin. Because skin on skin is the most effective, but you aren't going to be effective if they're uncomfortable. So we want to be within their comfort levels. So that's why I didn't do the calves on that. So once we get the calves, we come into the Achilles. I've never heard of a runner with any Achilles issues, so you don't have to worry about nothing here. Just kidding, that's sarcasm. Well, calcaneus is the densest bone in the body. That's your heel bone. The Achilles is a fantastically strong tendon. And as it comes down, it's not just a lump stuck into the bone. It fully spiderwebs and covers the entire heel. And if you don't pay attention to all these connections, they're missing out. So you can come down, and we're going to change things up by putting a stretch through it. Pressure good? It's okay. And so you see how I'm just doing this with my hands. So I really don't have to like, a lot of people will say, oh my God, it feels like you have the strongest grip. Not really. It's just the use of leverage. Here we go. Here we go. Here we go. Okay, we're satisfied with that. Couple circles around the ankle bone. Blood flow. This is a lot of skin on bone. There's not a lot of meat. If there's not a lot of meat, there's not a lot of blood. And so that's why we want to do things to encourage the blood flow. Then we come up through the arches. His feet are thirsty, so get a little bit more lotion. And now we're going to make it active because he's a little ticklish in his feet. So as I come through like this, you pull your toes up, okay? Go ahead, pull your toes up. Good. And I can feel all kinds of crunchies in there. And if you wanted to be ultra thorough and you didn't need them to walk the next couple of days, you could work all those out. And we're not breaking them up. The brain is reorganizing. That's all that's happening. So another grip is this, where you come up through the foot. You can come around and look. So always I'm leveraging him into my thumbs. So I'm pulling, tractioning him all into my thumbs, going up. Then we come up through here, work in between. See that pin and stretch happening? In between. All your toes, do your toe work however you want to do it. And then you would go, boom, make it externally rotated again. You're coming off the foot, reintroduce. See? And then we are exactly where we were starting that leg. It is. It's choreography. It's massage choreography. You're here. Okay.
So let's have maybe Ashley start since you got some.
Okay.
Yeah?
Yeah.
Okay.
So once you check that internal rotation, you're doing rotation,
Oh, okay.
you're paying attention to how this feels. You're like, oh, okay, how's that moving? And you probably haven't felt a lot of hips rotation because you've been working on rubbing skin.
Yeah.
So just pay attention, like, oh, can it go further? Like his legs move pretty good.
Yeah.
Then exactly, you go out. You're doing a little compression, introducing what you're going to be doing, how you're going to be doing it. And then this hand meets this hand down here, and then you do traveling thumbs. So you want the pad and the joint making the pressure. See that? Pad and the joint. That's it. And are you able to have less of a bend there? So that you want, as best as you can, your radius and thumb to line up. Then you can go back to palms here. And if your thumbs aren't comfortable, you can do palms down here. Okay? Okay, good. Once we did that, we're going to sink under him. You feel that hip bone? His hip bones aren't hiding.
Yeah.
And then slide down into that SI joint. She feel like she's in the same spot as me? Cool. Fingers do this. Go ahead. Look at it. You're moving them. Forearm below the hip bone. That's it. Notch your elbow point. And be careful with we don't want to get too close to the middle. So fingers up, elbow down, and pull his body down. So your elbow's a little too close to midline there. So you want to come here. So pull down. So no sliding. Sink and traction the meat.
Yep.
Inhale up. Sink and traction the meat. Inhale. Sink, traction the meat. Now this motion we're doing, try to smooth it out. Inhale. He's gently sink and pull. Sink. Nice. That's it. That's it. And so shoulders are poisonous to ears, so use this muscle to keep everything down away from the ear. Hello, Daisha. You're going to talk her through a little bit. I'm going to run to the restroom. And this is still on. Let's see your myofascial hand placement.
Oh. So I just did one hand, but I thought you had two.
Yeah, I'm always leaning on something. You can have two, you can have one. Doesn't matter. But you want that contact to be solid and consistent. He knows when his quad's going to start doing the thing. It's doing it. You feel it moving under you?
Yeah.
Fantastic. That's the best way to know if your hand placement's right.
Okay.
So let me see how you do it with two.
It feels really uncomfortable
Okay.
with two.
So then just switch. Just do this one.
Okay.
And getting used to being able to do it with both hands is important because you got to work both sides of the body.
Yeah.
And then, nice, she just switched her legs. So that gave you better leverage.
Yeah. You can't go that way.
And then try to lock out your elbow, and then now you can just lean into it. Keep that shoulder down. Nice. It's almost like a paddle coach, huh? Shoulders down!
Yep.
One thing in common, they belong as far from the ears as you can get them.
Yeah.
Before we start the other leg, why don't you get comfortable with this?
Okay.
So I've done it so many times, so long, it kind of just falls where I want it.
Yeah.
But when watching you do it, getting this curve on the curve of your leg is going to be kind of like the sweet spot.
Yeah.
And if you turn your body away, your personal space is further from theirs. If you turn towards them, your personal space is closer to theirs. So you decide, and like I like to be almost facing his head because I want to see what's happening up there. Like if I just lean back, I can see his whole head moving. So even if he's like one of those people that doesn't feel anything in his body, And I'm like, do you feel that traction in your hip and low back? No. And I see his head moving.
You know it's working.
It's working. And it's okay if their response isn't the same as what you're looking for, because it's probably true. He doesn't feel it. But if his head is moving, it's happening. And I don't need to like be like, well, do you feel it now? Because his head's moving. So we don't have to force anything. And then sometimes too, you might be like, does that feel better? Or does that feel better? And people with sciatica, because I fast forwarded it, but it is mentioned in that video, there's a lot of that stuff you wouldn't do. And so, yeah. So we're not covering sciatica. You're learning how to get the basics down right now. That'll come later. So don't worry about that. It's just if in the next couple weeks while you're practicing, you're like, yeah, I'm supposed to do this, and they have sciatica, and they're like, oh my God, I'm dying. No, then we don't do that with sciatica. So if they have sciatica and you're doing the lower body, you're not going to practice what you learned on the sciatic person. Okay. Something. And then if they're uncomfortable with that, you just work with what they got. So like I have a client, she wants to wear a t-shirt. I just worked through the t-shirt. I demonstrated. Yeah, you're good right there. We can still get to all the stuff because it's still all there. So I put his shoulder on my knee. He's wearing his shirt. He's very modest, so we get in there. I find his ribs. There's pec minor. We still can do all the stuff. I can find subscap. I can find infra teres. And so knowing your landmarks is important because it's a little harder to find through clothes, but totally doable. So you work where people are comfortable. Their comfort is a little more important than yours.
So he did several things in this one that he didn't do in the video because she was wearing pants and he's not. So he could do a lot more.
Right, so with pants, we can't do myofascial because there's just not enough grip. All right, so here we are. Make nice on the brain. So I just finish his neck,
We need it for video.
come around.
Keep in mind.
He knows where I'm ending up. I'm starting to see how his hip moves. If there's restriction, some people with limited internal rotation, it's going to be like, and it can't move. So this is kind of where we're learning more about end feel. If you push your finger back, that's a soft end feel. If you straighten your elbow, that's a hard end feel. If you have a joint that should have a soft end feel, but it's a hard end feel, you got to figure out what the restriction is. And so sometimes it's going to be a joint capsule restriction, and most times it's a muscular restriction. What are his muscles limiting? Muscle restrictions are much quicker to resolve. So here we got down here, internal rotation. So far, so good. And now we're just doing compression. One going down, one going up. If you're trying to make your session last longer, you can match their breath with everything, and that'll slow everything down. So then we come back, maybe do it again. And this time we know we're going to do traveling thumbs. If your thumbs don't do this well, or it's uncomfortable, it's too much pressure on your thumbs, the heel of your hand works. That still feels good, right, Martin?
Does it feel as good?
Thumbs just get more specific.
I think like, and I don't have shit like nothing sore down there, so. If it was
Except on
super
this
sore-
side, it's sore.
It's not bad. If it was super sore though, thumbs would be like, oh.
Yeah. So now we're going to come in. So I have this here because he was a little tight. He's not as tight anymore, so we can take that away. So to get to the SI joint, this joint right here, easiest way is to go where the back meets the table, and then I follow it down. And now the pads of my fingers are on his SI joint, and I can move his whole body with that. We know the spine runs down the middle. I'm repeating for Ashley and Sarah because this is mostly for Dacia's review. The spine runs down the middle. SI joints outside of the spine or lateral to the spine, so we don't have to get in the middle. As you get lower, the middle is personal space, and we want to avoid personal space. So if I was following his breath, he'd inhale, and I would push up with my fingers. As he exhales, I lean into my forearm elbow, and I'm going down and tractioning down. And so I want to have good, strong posture. In, I push up, out, I push down, and I'm tractioning his hip. And there's no set number of times you would do this. I like to do it till I feel it change. And his changes fast. Like that third one, it changed. But you might get someone who doesn't change after 6, and you just got to move on. Just move on. So now we come, still making contact. We already know where ASIS is, the hip bone. So we're going to come in, forearm, and we internally rotate. So we're pinning TFL and stretching with that internal rotation. Pin and stretch. Now, you know with my body position, you can put a lot of pressure on there. And you just find what works for you comfort-wise, and then they will also let you know. Good, good, good. From there, we're going to get some skin, and then this is myofascial. If it was someone with looser garments, I could lock in right under the ASIS. In his case, I'm going to be a couple, like an inch or two below. That's okay. But if you can get the top of the quad and push it down, that's good. We're close. His quad will still do what it's supposed to do. And so I'm like really leaning over, locked in. My force is down and towards the
And
feet.
where are you putting the pressure, just like on your palm or your whole?
The whole, that part that you can see of my palm.
Okay, this whole bottom,
The heel.
the heel, yeah.
And I'd say I have a little more pressure on the outside, pinky side of my heel. Like maybe 60% and 40% on the thumb side. Oh, here we go.
Shoulders supposed to feel as light before.
Oh yeah. So go feel, squeeze in front of my fingers. All of you guys, just feel how tight his leg is. Yeah, but big hand. Squeeze that sucker. Feel the tension? Good. It's already letting go though.
Yeah,
It's like,
yeah.
come on. Come on. And so if you get too far from yourself, you can scoot yourself down, move your feet down, so you always have that good leverage and you're not overextending anything. I'd say this is one of the harder strokes that I do, just because it's so slow and I'm leaning so much onto one hand. When I do the second stroke down, I'm going to use both hands so you guys can see what that looks like. It doesn't matter a ton. And if the quad was like 4 times this size, it doesn't matter. The point is your brain, his brain, is feeling that constant pressure, and the brain will change under pressure. It'll change the output to the quad. As you get more used to it, and you're confident they're not going to contract their quad, you can hook the heel of your hand and push their patella that way, not that way. So if you're going to traction the patella, Sometimes you might say, make sure you let your legs stay heavy. So now we're going to go in, 2 hands. All right, I just changed my hips to make this feel better. And it's a little more pressure. Is that okay still, Martin?
Good.
Okay. And I'm leaning, so I'm not balancing, I'm leaning on the table. Oh yeah, these are good ones.
It doesn't work if there's not enough pressure.
Correct. So I got tired, I just switched my feet. It's been a long day. Surprisingly, even this stroke, does your friend that has crazy tight quads also have a low back pain issue? Oh, a lot of times people with really tight quads also have low back stuff. And if you do this on their quads, their low back is way better. And they're like, what? He's locked in pretty good.
Yep.
You're cruising.
Yeah.
Now get just below the knee. These 2 fingers on the inside of the soft, everything's soft. And you just, oh, he's like a baby.
I think he's
That must feel weird.
to bottom both.
A little bit,
Feels kind of nice.
but not bad, yeah.
So you are.
I'm just
Oh, you're
going
just doing
boom,
the same
boom.
and pressure
Yep.
and.
And then you're in a traction a little bit. Don't go to lockout. You just want to take them with you. Yeah, that's it. Take them with you. And then release, pull, release, pull. Nice.
All right.
So now we're going to go
Oh,
to the transition.
Yes.
Here. Get your foot down. You good? Back hand, just drop him into your elbow.
It's like that. Thanks.
Just kick the stool.
There.
Good. Yeah. Easy?
Yeah.
And make sure you can get your hands up on there a little bit. That's it. Can you get pressure down? Nice. Now just play with the rotation. So if you control the head of the femur and you rotate, you're not going to torque the knee.
Okay.
Because if I'm not controlling the head of the femur, all the rotation goes into his knee. That's no good. So I want to control that head of the femur. So my intention is to do this, not that.
Which is also part of this grip.
Yep.
You're holding everything.
So I make sure my grip's a little high. That's it.
Okay.
Is that hard?
No.
Okay. Good.
I think you're okay. It's fine.
So now I want you to turn this way. Yep, that's it.
But you.
So go ahead. Yep, take your hips. That's it. That's it.
I
Now-
want to do that on both places.
Now bring it in.
Now bring
Now,
it in.
now turn, and push, 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 push.
Yeah.
Get the glute.
You don't have to be super gentle.
Yeah.
That's how I start always.
Yeah, yeah.
Okay.
So what you want to set up,
Yeah.
and I know this is the heights are different, is you're. So if I'm here, I'll get on the table with one more time, because now I can just lean into them. And so I'm thinking, if I have breasts, where am I going to hold? So I got to be a little higher so it's not in my chest. I don't have breasts, so I come in here and I'm like really hugging in on it.
Right.
And so those are the considerations. What are you going to, go ahead, play with that leg.
All right. I got it.
No, I'm gonna try it out. I'm gonna try it out.
Okay,
I don't have any close speed, but now I forgot what I was doing.
so here,
Oh, but now I need. That's. Yeah, that is a. It's okay.
a little high.
I'll stretch on this one.
It can't go down much. That's
Oh,
it.
I don't have any. Here.
Good. Yep. Boom.
Locked in.
And then here. Yeah. And you can play with putting his foot behind your shoulder blade. That's it. And then lean yourself back on it. There it is.
Oh.
There it is.
Okay.
And then traction him.
This side's more awkward. But also.
That's the one to
I probably
practice.
should have put that. Okay.
That's the one to practice. And then from here, you're going to slide in. As our friend Wassa would say, take your friend shopping. So you're not working to hold that leg.
No.
This is all muscle and bone. Good?
Yep.
And then coming up. That's nice. That's better than when you were on this side.
Okay.
Push straight in. Good. Now twisty it.
Twist it out this way.
Either
Oh,
way.
this is the end.
Yep. So to come in, you might want to bring that knee up on the table again. Switch your knees. Bring that one up. Now look how far you can bring it.
Ah.
And then push it, push it, push it, push it, push it.
I'm not going with you. but
Yeah.
Okay.
Yeah. So you could have brought your knee over here too.
Okay.
But this is like practice. You're going to practice yanking, not yanking, tractioning. Tractioning. Oh, you guys are so quiet out here.
Does that feel good? Like,
Yep.
Yep. I'm gonna ask for parents and see something.
no, your kids are just so calm. Like,
You're saying that again.
It's off.
She turned it on.
Oh, it's on. Oops. It's my first
so
day.
right here, is this what I'm doing?
Mm-hmm. Okay, so your hands are on either side, and you're pulling the tissue. So think about pulling the end of his hamstring into the top. Oh, that's too much meat. You just I'm gonna turn this out. You're just right in there, and that's where you stay. Can you see that?
Mm-hmm.
That's it. So here, so face his head, and that'll get his leg more in line with his body because he's kind of out here with your grip.
Okay.
Okay? Put your fingers. So you feel those two tendons?
Mm-hmm.
That's where you're in between. One, release. Two, release. Three, release. You see I'm only pushing with these two fingers?
Mm-hmm.
Your other fingers are to guide you, to keep you in the right place.
Okay.
And I would probably turn your hips and then lean in. So get your foot further in on the table. That's it. Now when you traction, watch how the hip pulls straight through. Go ahead and lean back. Boom. So always think Vitruvian man, anatomical neutral. It's the middle stance because you see both stances because it's a plate drawing of, they can't draw motion, so they draw multiple planes. It's the middle one
Okay.
where you're just like straight through the socket. So the line, if you drew a line from his shoulder through his hip, go ahead and pull his leg straight. That's the line you want to be in.
Okay.
Okay. Okay, and so the next grip, come here, and then you just slide it, and you let it sit in the crook of your elbow.
Okay.
So this is totally like, I'm not
Yeah.
working. Easy, right?
Yeah.
And it helps hold this away from your ear.
Yeah.
What a bonus. So now make sure that you're holding him close enough that when you grip, at least your top two can be on top of his knee so you can push straight down.
You're pushing
Straight down. Yep. Yep. Just straight down. And then that's when the rotation comes, when you go straight down. So straight down and rotate. So you're going to need to swing this leg up.
Up here?
Yep. Push down. Rotate. 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 Get down. Now go rotate, 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 and push the knee to you feel the glute? Good. But you got to keep these down.
Okay.
Okay, and now push down and rotate. So for him, it's internal. For you, you're taking it out.
Right. So down and out.
Yep. But I mean, really, it's like you're holding on to his knee to support your weight. And you can bring your leg off already, because on this one, if they're really mobile, you're going to go out and you're going to have to walk with them.
Okay.
So get it straight in, rotate, and then come out. Come back, straight in, rotate, 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 and then come out. So you're plunging it and twisting, and then releasing. It's good? He gives good feedback. Yeah. So straight, and then use that body. Yeah! And then come out.
Okay.
Yeah.
And then what do you do when you rotate it like far? You know how you
I rotate it and hold it for a second,
Okay.
and then when I come out, I go back into traction.
Okay.
So I'll show you on this side because you're on this side. Your brain is on this side.
Okay.
I'm gonna.
My brain is on this side.
Yep. So you're saying when I go this way, what do I do?
Well, there's something where you release his leg and then.
Oh, okay. So we checked, and it didn't have the range, so I grabbed underneath. And this is again, if the person is too big, you ain't doing it.
Yeah.
So you just, I'm distracting the head of the femur from the acetabulum, from the socket. So we go boom. Now it doesn't matter how tight his hip flexor is because it's shortened. Now I've lifted the ball out of the socket, and then we get to see what his real range is. Because there's no compression of the joint. So you're just simply grabbing it under, decompress, and you don't have to decompress a lot. I'm not picking up his body weight like that. I'm just decompress.
Okay.
It's like maybe 15 pounds, 10 pounds of decompression. Yep, that's it. That's it. He moved already. Go. Go, go, go. That's checking the joint capsule end range.
Oh, cool. That's grossing me out. I'm like, oh my
It's not a chicken bone. He's not cooked. It's not going to go.
Can you show me the Achilles thing too you were doing?
The stroke.
Yeah, just
Yep.
how to do it.
So I'll show you inside.
Okay.
So I'm just pulling and pulling down through. Release, pull through. Yep, so your pads make contact in here and then stretch. Yeah, that's it. And then you switch and you stretch. Is she putting pressure?
When you switch, there it goes.
So it's all the same principle of pin and stretch. We're shortening the Achilles, locking in, and stretching through movement.
I think just keep it to the heel. Just keep it.
Oh yeah,
Keep squeezing.
come all the way through here. Right, all the way to the
Yeah.
pad of the foot.
Okay.
It's good. It's good clarification. Good feedback, Martin. Thank you.
Yeah. Thank you.
Okay.
Awesome.
Anything else? So practicing these things gets you really good at feeling the end feel. This is a soft end feel. This is a soft end feel. This is a soft, you see how it bounces? This is not a soft end feel. If I bounce this, it breaks. That is a hard end feel. When you encounter a joint, this is a hard end feel. It doesn't move. When you encounter a joint that should have a soft end feel, but it feels hard, that's when you decompress and check. If when you decompress it's still rock solid, might be a good idea for you to go get some imaging done. Because maybe the joint's fusing. Maybe it has no more cartilage. Maybe there's a bone spur that's locking it in place. Maybe it's fine and the muscles are really tight, but you'd rather know and get all the scary stuff off the table before you're like, oh, I'm gonna just work this thing. And yeah. So knowing how, there's not very many hard end feel joints in the body. There's two. There's two. And so even an ankle, look, this is plantar flexion, still springy. Dorsiflexion, springy. We know the hips are springy. The hand, fingers and wrists, shoulder, where does that end? Neck, same thing. Every end range in the neck. And you will meet people that you go to rotate their neck and it's like a hard stop.
Oh, yeah. I've definitely felt that.
Don't mess with that.
Oh, okay.
You can decompress it linearly, but don't try to, if it's a hard stop, like an elbow or a knee in the neck, if they are curious, hey, the best way to find out, go get some imaging. Yeah. You wanna? I haven't seen Rugrats in ages. Is that Rugrats?
Yeah, but there's Rocco and Arnold too.
Yeah. Okay,
There's everybody.
cool. How tall are you, Daisha?
5'7".
Perfect.
I thought I was 5'8".
Maybe you
So
were.
long.
Maybe you were.
Well, Trisha took my scanning at Level Up and she claimed I was 5'7".
And now you're forever upset.
I was like, all these years.
So think about this curve on the curve of your leg. That's good. Okay, does he feel solid? Lean back. How's that feel? Solid? Effortless? Okay. Can you lean back without this hand involved?
Oh, like if I leave my arm?
Oh, I was like, is that a scrape? Yeah. And you're good? So now you can come in, these fingers, feel the two tendons. And so you're just rocking, pressure, release the pressure. Nice. She's got it, right?
Just less on top and then more.
Oh, under here.
Yeah, right
Got
there.
it.
Beautiful. Good. See how easy it is? You're doing the moving. You're moving him. Like piece of cake. Okay? And then from there we transition. So always solid contact. And then from here you just slide the backhand, elbow swing. Yep, that's it. Good. Now you got this control. So make sure at least two are on top so that you can drive the femur down. And don't be scared. Like lean into it. That's it. Easy? Okay, now twist. So if you're going that way right now, yep, you got to go with it.
And I push the whole time.
Yep, you drive hard. Good, 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 good. And then when you come out, you're going to come out in traction. So to make that easier, so you don't have to go down like this, we got pressure, pressure, rotation, and then I come out and I take a step back and then I traction like that. That's it. And then drop. Yeah, there you go. And then you want to practice going this way. So same grip, push the hip in. And when I say push the hip in, the femur goes into the, yep, go this way. And then stretch. That's the glute. You feel it? Beautiful. Push in, yep, good. Nice. So you're aiming this knee to this shoulder after it's rotated as far as you can go. Go, 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 go. He can go more. And then stretch. So you had a little more rotation in there before. So go ahead, rotate, 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 rotate. Now go for the stretch. And the stretch comes sooner. Because you're taking the slack out of the system with the rotation. Okay?
So at what point do you rotate it? Like in the angle?
Well, everyone's different. Like if I put everyone here on the table, their angle would be different.
Okay.
So you go, so if I'm rotating him externally, zero tension, 0, 0, 0, 0, 0, 0. A little bit of tension starts to build. Now I'm going to lean into it and go, and then it just doesn't want to go much more. And then I put him in the stretch. So if he was focused on, let's say, gymnastics, calisthenics, and mobility, this would move more. But he's been run focused, so he's a little stiffer than normal. And so if he was focused on all those mobility, calisthenics, gymnastics, he would get 90 degrees of rotation, no problem. You've had it before.
Yeah.
And so it just depends on what you're training for, when and how determines where your mobility is. So right now, I mean, we could get him to 90. You let me know if it's too much. So I'm just using more leverage. That's right about 90, and then that stretch comes sooner. And it's more intense. But I kept pushing because his end feel was soft. There was no hard stop. And of course, I was watching his face, and he's still happy. Yeah. All right. Any other questions while we got this fantastic specimen on the table?
I wanted to practice this one too,
Okay.
where you do the knee thing.
Oh, yes. World's biggest thumb. By all means, practice that. So
It's probably
scoot
hard.
this forward.
This forward.
Yep. Just no shame. Hook under that bolster.
Okay.
Okay. So I'm going to be your mirror. Getting in there. So,
I think on this one, don't feel like you're doing it too hard.
yeah, don't worry.
Because
It's a really broad pressure. So you just lean into it and then straighten his leg. So push forward and straighten his leg. That's it. That's it. That's it.
And
And
you put lotion on your knee to do that.
if I'm not wearing pants or, yeah,
Yeah.
and if they're not wearing pants,
Oh, so if you're wearing pants, it's okay to do this?
yeah, you're not going to,
just so it slides.
yeah, you're not going to pull his hair with your pants.
Oh, okay.
The only risk of hair pulling is skin to skin. And even that, because it's such a broad pressure, this isn't bad hair pulling, right?
No. Yeah. If it feels like you're doing it hard, you do it like twice as hard. And you're fine. For this one and for the pushing down one.
Yeah. Nice. Now get a good lean into it and then you feel that moving on your knee?
Yeah.
Okay, now come back down. Lock in here. And then say he's a big dude.
Oh.
Pull him into your knee. Okay, go ahead, straighten your leg, Martin. Now it's active.
Okay.
Now go lower and drive hard. Pull him into it.
As you pull, push.
Yep, push your hips. That's it. But he can straighten. If you're pulling,
Okay.
you don't have to lift. He's going to straighten it.
Okay.
So drive your hip into his.
And then slide down.
Okay, now straighten your leg, and now you slide. Slide, 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 slide. So like if she hasn't slipped now, she probably ain't going to slip. This is a pretty secure hold.
Yeah, it's just, I don't understand how you get the pressure into his leg.
With your
It's
hips.
a lot better now.
Okay.
Yeah.
So you're driving your hips straight forward.
Okay.
That's it.
Okay. Okay, that,
Yeah.
okay.
So watch my hip. So I come here to load him, and then I go here to put the pressure. This to this. So it's actually my outside glute that's working.
Okay.
And
All right.
say you have, you said you had the big person?
I do have a big
Okay,
person.
put his leg down. I'm going to show you something. And you're friends with them?
No,
Okay.
just a massage.
Then ignore this.
Okay.
If you have someone that you're friends and you're okay to practice with, then you're here. You're on the table with them.
Yeah.
If you have a cheap folding table, your knee only can go on the outer edge.
Okay.
One day your knee will go right through the middle if it's a cheap folding table. So, but here, watch my hips. See how I just drive in?
Yeah.
And put your hand like this. And if it's too much, you say. So you see that amount of pressure?
Yeah.
And that's just from my hips.
Okay.
I'm not like working.
All right.
You want to feel, either of you want to put your hand in there?
I have like that kind of thing, but it's
So if it's too much, just, so I'm just driving my hips forward. And so if you're, no discomfort in your hand.
No.
So I'm going to drive my hips forward and pull them into it. So it's significant pressure. Go ahead. But it's so broad it doesn't get you. So this is without pulling him into it.
Okay.
And I'm just driving hips. And then this is me pulling him into it.